So we will go ahead and get started, knowing that other folks will be joining as we go through our discussion today. Let me just say a few introductory remarks, which will be followed by Dean Susan Abraham here at PSR, that will do a brief introduction of our really distinguished presenters today. We are grateful for their participation to be with us, and we'll do a welcome to them in just a little bit. We will then follow just some reflections from each of the three of them, and the focus of our conversation today will be on equity and ethics in the time of this pandemic, but as well as an opportunity to reflect on the lectionary text for this Sunday. This is the second of our webinars in seeking ways to respond to this moment and the need for theological reflection on this, what we are living through as communities around the world. And then we will have an opportunity following that for engaging questions you may have, and so we invite you to share those on the chat. As we begin this, let me just again say a couple of kind of remarks about where we are at PSR, how we are responding, and the framework of our long-term vision for how our role as an institution and as a network of people, all of you connected to PSR one way or another, are responding. One of the things we are doing is trying to offer these webinars each week. We will continue to do them at 2 o'clock on Tuesdays and invite a variety of folks in our network to be part of that conversation. One of the things we invite you to offer to us are, what are the issues you feel would be helpful to include in these conversations on Tuesdays? We will continue to do this through the month of April, and depending on both response and the need for it, we'll continue to provide and beyond that as well. And we would greatly value your input into what kinds of conversations might be helpful for us to offer reflections into. We will draw from our faculty, our staff, our students, alumni, others, to try to draw on this rich network that makes up PSR to respond. As we enter into our conversation today, we have all been brought into a rather disorienting moment in what it means to be human. In my own personal reflection on this moment, I have just been deeply aware of how this very technological, very remarkable society we live in is dealing with something that feels nothing short of medieval. It really is the level of a reality we are facing as parallels only in pandemics of previous generations. And in some ways, this invisible impact, or this invisible organism, it has called into questions our broad understandings of ourselves, of our technologies, of our might, whether it's as nations, of the boundaries we think to create for ourselves and our capacities. And so it really has called into question many of the things we think about. Last week, we discussed how this is truly an apocalyptic moment, apocalyptic in the way that our religious communities understand it as revelation. It has revealed the cracks and limitations of our society, the inequalities with which we live in our health system, in our economic distribution, in the differences between various nations. But it has also an opportunity for revelation to be much more inspirational. It has revealed the resilience of our communities, the creativity of our people, the ability of small churches in rural areas to turn into a virtual community, virtually overnight, as well as the capacity of our spirit to create ways of connecting with one another and responding. It has revealed the remarkable willingness of people to make sacrifices, that very problematic religious term about what it means to make a sacrifice for the whole and greater good. All these things are what we are wrestling with. As societies right now, within the Christian tradition, we are entering into a Holy Week, a week that really plays in large story, this cosmic struggle between life and death, the recognition that sometimes our deepest hopes are dashed and challenged and disappointed, and yet also the invitation to sit in that space of uncertainty and the celebration of possibility of life, even in the midst of death, and to have the courage both to name grief and sorrow and death, but also the courage to speak the possibility of life. So all of these things whether it's in the Passover celebration in the Jewish community, Holy Week within Christian community, or many other festivals, stories, and narratives that help us to understand the large issues with which we live. So we are grateful for the opportunity to be with you in this conversation, and I invite our academic dean, Dr. Susan Abraham, to introduce for us our panelists for today.
Thank you, David, and welcome everybody. It is wonderful to be with you all and to see you all. I am delighted to introduce our three speakers today. You may have received the short bios that we sent out, but I would still like to read them because this is the best of what PSR continues to be. Our first speaker today will be Reverend Dr. Karen Lebacqz, who is Professor Emerita at PSR and served as the Robert Gordon Sproul Professor of Theological Ethics. Her publications include more than 6 books, among them Justice in an Unjust World, Sex in the Parish, and Ethics and Spiritual Care. She has published numerous articles in scientific journals and church magazines in the areas of professional ethics, bioethics, and ethical theory, and has served on many policy-making boards and bodies, including the National Commission for the Protection of Human Subjects. Following Professor Lebacqz is Reverend Winford Horsley, who is a graduate of PSR 2017. Reverend Horsley is a spiritual care and palliative care chaplain at Kaiser Permanente Medical Center. He earned a BA in political science from California State Polytechnic University, an MA in public administration from the University of Southern California, and an MDiv from PSR. Following a career in administration, Reverend Horsley also completed a full year of CPE through the Alta Summit Medical Center's Chaplaincy Residency program. And finally, anchoring the speakers is our very own Reverend Dr. Mary Donovan Turner, Professor Emerita, PSR, who served as Carl Patton Professor of Preaching and Vice President for Academic Affairs at PSR. The 2020 recipient of the Lifetime Achievement Award by the Academy of Homiletics for Preaching, Teaching, Research, and Writing, Mary is the author of The God We Seek, Portraits of God in the Old Testament Words, Reflections for Preaching, and co-author of Saved from Silence, Finding Women's Voice in Preaching, as well as numerous articles, sermons, and research publications. Welcome to our speakers, and welcome to everybody. Professor Lebacqz.
Okay, here we go. Okay, I'm getting a very difficult audio echo. I don't know if that cannot be fixed technologically, we have a problem.
Yeah, we experiencing this.
Hi, this is Emily. Let me just troubleshoot for one moment.
Sorry about that.
Okay, is that better for everybody now?
Yes, it is for me. I hope it's better for others as well.
Okay, thank you.
First, let me say thank you for the invitation to be here. You see on the wall behind me a grid. This is normally my design wall for the quilting that I do, but I am doing no quilting at the moment because I am spending my days making homemade masks for people to wear. And this is what pandemic does to us. It changes the way we live our lives in ways both big and small. What I am going to share with you today is an essay that I wrote almost 15 years ago at the time when we were going through the avian flu pandemic. When I left Pacific School of Religion, when I took my official retirement, I spent a year as bioethicist in residence at Yale University. And it was just during and after that time that we went through this avian flu pandemic. And so I wrote an essay then on pandemic justice. And I still struggle today with the question that I struggled with at that time. And the question is this: it seems to me that from a Christian perspective, there are two values that absolutely should underlie every public policy. One of those is the equal value of all people. And the second one is the option for the poor. The question is whether these values can be upheld during times of pandemic, or whether they need to be compromised or modified, or at least put together with some other important values. I don't like to say overridden by utilitarian concerns, but it is a question. I have never been a utilitarian. I will never be a utilitarian. I will always be a person who believes that there are principles that should undergird everything that we do, but pandemic seems to threaten most of our important principles. In fact, some people would say that justice simply does not apply in times of a pandemic, that justice requires more organization, more order than we seem to have. And certainly in this last month, I think we have seen a tremendous amount of disorganization, and it becomes extremely difficult to hold on to principles of justice in the midst of chaos. And we are experiencing quite a bit of chaos. But even so, I would say that we need to hold to principles of justice. So what do we do when we have a pandemic? Just before I logged on to do this webinar, I noticed on TV that hospitals are now raising the question, who will get the ventilators that are available when we do not have enough ventilators for everyone? This is a justice question in the midst of pandemic, and it's going to require triage. Now, lots of people think triage should never apply to medicine, that somehow the arena of medicine should be that everybody gets what they need, and that would be lovely. I have lived in both Canada and in the UK, where there is universal access to healthcare in a way that we do not have here in this country. And frankly, I would trade our system for either of theirs. I believe in universal access, but universal access would not solve all the problems of triage. And it is true that our current medical system already is rife with triage decisions. If you go to the emergency room, you will not be the first person treated if there is a gunshot wound in the room and it is not you. Somebody else will be treated first, because we do triage. And generally speaking, what we do in emergency rooms is we triage by trying to take first and foremost the people who are the sickest, the people who need the most care in order to survive. One question might be whether those kinds of principles that we have developed, or those policies that we have developed in other settings, would apply in cases of pandemic. Now, quite frankly, right now we are in a position where we do not have a vaccine. And at the time when I wrote my essay 15 years ago, there was also no vaccine for the avian flu. So my concern was based on treatment decisions, not on decisions about preventive medicine. And that's the situation that we're in today. So I want to make clear that I think principles of justice might differ depending on whether you are talking about prevention or whether you are talking about treatment. But at the moment, we have no vaccine. We have only our rather feeble efforts at social distancing as our way of trying to prevent the spread of this virus. There was a lot of thinking about triage in the midst of wartime, and I'm going to kind of pass over all of that and just tell you what I decided finally when I thought about this 15 years ago, and then a few reflections on whether I would still agree with myself or whether my thinking has changed in the last 15 years. Remembering that what I am trying to do is uphold what I see as two really important principles: the equal value of all people, coupled with an option for the poor. So what I proposed then is that we should have three principles in time of pandemic. The first of those is what I would call expediency. We should save first those who are in the best position to save others. Now, that means, of course, our nurses and doctors and other healthcare workers whose work is absolutely critical for saving additional lives. I will tell you quite frankly that when I presented this idea some years ago to nurses on the north coast of California, where I was living in 2007, they were really upset. Nurses are not used to the idea that they should give themselves priority. They are used to the idea that they should sacrifice everything, if need be, for the sake of their patients. And you will still hear that, even as you also hear them begging the United States to provide the safety equipment that they need today. So my first principle is save first those who can be most helpful for saving others. My second principle is a principle of conservation. This is a little bit along utilitarian lines. It means using resources to save the most people possible. It is okay to be efficient and to require efficiency in our medical system. If you can get someone on and off a respirator in 3 days instead of 10 days, then that respirator is available for someone else to use. So it is not wrong to try to ask who will get better quicker and how can we best spread the resources that we have. The efforts that many hospitals are making today to take one respirator and serve 2 patients with it by modifying the equipment really suggest that they are trying to act on a principle of conservation, saving more with the resources that we have available. My third principle may surprise you, maybe not. I think priority should go to those who have dependents, to mothers and fathers with minor children at home under the age of 16 who need their parents for their own well-being and survival, and to those who care for adults who cannot survive on their own. So those are my 3 basic principles, and I have rejected some very common principles. One of the things that we often do is we say, first come, first served. If you get here first, you should get served first. I reject that. And part of the reason I reject that is that the poor are never the first to go to a healthcare system. Never. They are the ones who end up in the emergency room because they don't have access to good healthcare via private doctors and things like that. But they are not the first to go. And so if we do want priority for the poor, first come, first served is not a good principle. I also, of course, reject any principle that would suggest that priority goes to those with more money or more social worth. And I reject priority to the medically neediest, because that would conflict with the principle of conservation that I have offered. Now, I'm going to summarize and finish this by saying that under my principles, I would be at the end of the line. I do not have dependents. I certainly am not one of those who is a primary physician or nurse or caregiver. I'm old enough and have enough arthritis that I don't think I could be very helpful on the front lines, lifting pallets and moving patients, building new hospitals, doing the things that need to be done. And frankly, if my principles gave me priority, you should be really, really skeptical about my principles. So I'm happy to say that I would be at the end of the line if we operated based on my principles. So my friends, we are in a time of pandemic. We do need to find principles of justice. I don't like to let go of my principles of equal value and option for the poor. I think we honor equal value by being sure that we have a process that gives everybody equal consideration. We are not going to have equal outcome. Many are going to die, many already have, but we can honor equal process for people, and we can try to give some option for the poor by attending to the very special needs of our homeless populations, our immigrant populations who are in detention, and letting people out of prisons and doing some of those things that are being done in other countries. That's my time, and thank you.
Thank you very much, Professor Lebacqz. May I invite Reverend Winford Horsley to speak?
Hello. Hello, everyone. Can you all hear me?
Yes.
Yes, we can hear you.
First of all, I consider it a privilege and an honor to represent PSR. Thank you, Brother President, for the invitation. So many things have changed. On first week of March, I was on a Sunday. I went to work as usual, and I had full access to all of our patients. I had a number of patients I could just freely go in and out of their rooms and see them. I had an opportunity to journey with nurses and doctors and staff and participate in very important palliative care meetings. And palliative care is just a fancy term of providing extra care to our patients who are having to face painful end-of-life decisions or decisions in terms of terminal illnesses, whether or not to transition to comfort care, hospice care, or any number of things that require everyone to look at the whole patient, from doctors and nurses to social workers to chaplains. All that changed with this pandemic. All of a sudden, if you can imagine a hospital thriving with visitors, seeing their loved ones, spending time with their loved ones, journeying with their loved ones during the most daunting and lonely times of their lives, because if you've ever been in a hospital, and I have several times, it's a very, very difficult place to adjust to. So as an interfaith chaplain, a lover of people, and coming from a seminary that certainly promoted that, I was in my element. Advance forward to March 18th, and there's a new visitors policy based on COVID-19 protocols and restrictions. Number one, no visitors unless a patient is facing an end-of-life situation. And even with that, if there are extra precautions, say it's a coronavirus patient, you can't enter that patient's room. You can't journey with the family. You can't provide them with that needed support, not only from a spiritual perspective, but from just one human being to the other, because of safety and protocols that have to be enforced. Imagine not being able to see your loved one take their last breath. It's heartbreaking, to say the least. The only exceptions for that is, as I mentioned, someone facing an end-of-life decision, and only one visitor at a time. No visitors under the age of 18, which means that teenagers can't see their loved ones. Staff, doctors, and nurses, all those who I call first responders, you feel and sense a sense of heightened awareness in the air, but at the same time, you sense and feel that this is our call, this is what we've been called to do. So when I had the option of being able to work from home, remotely, or to go back in the hospital and be there for not only patients, but staff people as well, I decided that I wanted to be on the front lines. Because I'm reminded from my own personal theological beliefs, when Christ says, if you want to follow me, you got to take up your own cross and follow me. And that cross for me is being there for anyone that needs me at this point. I understand the need to take care of myself. I understand the need to practice universal precautions, washing your hands, wearing the proper attire that you need, understanding that I can only visit those patients that do not exhibit serious problems in terms of airborne precautions and other things that would prevent me from going in that patient's room, not just for that patient, but for the safety of other patients. So in other words, what I'm sharing with you all is a new normal. But we as humankind, we've always been resilient. We've always found ways to see about each other. So we're doing the business a little differently. For those patients that need chaplain support, and I'm not just talking about from a spiritual perspective, but someone just needs someone to say, I hope you feel better. You have a whole group of people that's rooting for you. We're praying for you. We can do that by calling the patient's room. And in some cases, if we're really lucky and that patient is well enough to pick up the phone, I can just simply say to that patient, this is Reverend Winfred, or this is Winfred, or this is Chaplain, depending on their faith tradition or no faith tradition. And just simply say, I care about you. How are you doing under the circumstances? Or in those rare cases, I can have the privilege of doing something that happened just this past Sunday. 41-year-old son of a patient. This particular individual was the caregiver for his mother for over 20 years of his 41 years of age. And I was called to journey with this person. And I say this person because of HIPAA requirements. I'm not going to say the ethnicity or the gender, but I was with this person. And I asked, were they a part of any particular faith tradition? And the person said no, and the look in the person's eye was, please don't put me down for that. And I just simply said, that's fine. I just want to make sure you have a support system. And at that point, I was able to humanize the situation and not make that person feel that because they did not have a particular belief system that they were any more or less important. And to look into that patient's eyes and see a relief come, I knew that this was my call to interfaith chaplaincy, which also includes those without a faith. And I was there when they took the person's mother off life supports and watch her transition. And I just simply said to the patient, who's here for you? The patient's son was an only child, no siblings, obviously, no father, no close friends. I said, can I do something for you? And what I'm talking to you all about is being on the front line and just doing small things. And the person, I said, can I get you some coffee? And the person said, yes, I would love a cup of coffee, Chaplain. So I walked out of the room. The doctors were crying, the nurses were crying, and I was walking down the hall, and all of a sudden a flood of tears just came. And I said to myself, this is the day the chaplain cried. And someone asked, Chaplain, are you okay? And I said, absolutely. Because the day a chaplain can't cry and the day a chaplain stops feeling is the day that that chaplain should retire. And that was when the magnitude of everything that we're dealing with hit me on a personal level. And I was able to, that day, journey with several more folk in a real critical situation. So what I'm saying to you all is simply this. If you are really called into chaplaincy, if this is something that you really want to do with your life, then you must meet people where they are and not where you think that they should be. Because it's always about the person and their family and their friends. And it's always about their journey. And it's always about their story. So while the rules have changed, effective March 18th, 2020, we are still finding creative ways to do what we've been called to do. So there's an extra level of support that I give who I call the first responders, the doctors, the nurses, the hospital staff, the folk that clean the rooms, the folk that prepare the meals, everybody that's entrenched in this warfare, and that's what it is. And we're going to get through it because as humankind, we're resilient, we're loving, we're kind, we are nurturers. And those are my reflections, and that's what I see. And that's why I've made a conscious decision that I will not work remotely from home. I will be there to answer the spiritual care pager, to seek and meet with folk in creative ways, even if it's not a face-to-face confrontation, even if it's not a face-to-face interaction. At least they'll know that Reverend Winfred is there And I learned these values not only from my faith tradition, not only from my parents, but certainly I want to compliment the Pacific School of Religion for inspiring in its graduates a sense of loving kindness and activism for all people. So the words that I have spoken today, they are coming from Reverend Winfred. They do not necessarily represent the views of Kaiser Permanente Hospital. I want to add that since we are being recorded. Nor do they represent the views of the Sutter Health System, of which I also work as a per diem chaplain. Thank you for this opportunity. God bless you.
Thank you. Thank you, Reverend Winfred. It is a great pleasure to see you again and to have you share with us. I just want to interject briefly before we focus on our next reflections. On your chat, you will see a reference to a particular resource from another alum, Carl Magruder, who's on this call as well, and our gratitude for his willingness to be available. He has been doing chaplaincy work through Zoom for the last 5 years, so comes with a lot of experience to this work of doing remotely what we have historically been able to do face-to-face. And so there's a website listed on that, as well as his email as an additional resource as we seek to respond to this from the perspective of our work.
Thank you, Reverend Horsley, for those wonderfully inspiring words. And if we can turn now to Professor Mary Donovan Turner.
Thank you, Susan, and thank you, David, for the invitation to be with PSR today in this wonderful way. I'm very grateful. One of my big projects over the last few months has been to open big boxes and sort through big boxes of papers and letters and photo that accumulated over my nearly 3 decades of teaching at PSR, my seminary days, and my early days as a congregational pastor. It's slow going, as you can imagine, because every box is filled with memories of places and times and people that are important to me. Last Friday, the very same day, I received by email the invitation from David to be a part of this webinar. I opened a box, and down in the bottom of that box, I found 3 large folders, in each a series of sermons I preached as a beginning pastor in the Southeast. I opened the first folder. The first sermon had a notation that said Palm Sunday. I had recovered a sermon I preached 35 years ago in a small town outside Atlanta, the Bible Belt South. And I was reminded of something that we already know, that preaching is a highly contextualized activity. And the sermon I preached outside Atlanta in the mid-'80s would not at all be the sermon I would preach in the West Coast urban coronavirus-ridden days of 2020. So I invite you to think about your context of ministry. Who are the people that you serve? What are they thinking and feeling and experiencing these days? What is it they need to hear in sermon or in a bedside prayer? I began my preparations by sitting in a comfortable chair and doing what I always do, which is do a deep reading of the lectionary text, a careful reading. I read first Matthew 21, 1-11. It's the story of Jesus' entry into Jerusalem. Because we know the end of the story so well, we know that his days will be filled with betrayal and misery and crucifixion. Jesus has been in Jericho And while he was there, he predicted his passion. And he had a conversation with the mother of James and John, who wanted to ensure that her sons had the best seats in the house, so to speak. And then on the outskirts of the city of Jerusalem, he stopped and he healed 2 men who were blind. And then he and this very large crowd that had gathered around him began the journey from Jericho to Jerusalem, 15 miles uphill. When Matthew describes for us what they find when they enter the city and the streets of Jerusalem, we find that the reality of theirs is very different from our reality. Unlike the deserted, quiet, eerie streets in San Francisco and New York City, really in the cities across this nation, they are walking into a city that is loud and chaotic. It's in turmoil, and it's busy. The inns are filled. People have come for the holy season of Passover, the holy day of Passover. And everyone has come to Jerusalem. So Jesus courageously, I think, walks into the city. And Matthew tells us that he's surrounded by this crowd of people who have come from Jericho with him. They're in front of him, Matthew tells us, and they're behind him. They're surrounded. He's surrounded by them. And they are the peasants and the urban poor. They are the hungry, I'm sure, people who are seeking healing, some of them sick. Surely, in the time of the empire, they are the silenced, and they are those who have been rendered invisible. And they walk into the streets of Jerusalem and they're shouting, Hosanna, Hosanna, which means save us, deliver us, help us. As I read that story, immediately I imagined around Jesus walking the streets, an exhausted nurse pulling an IV stand with no mask. A young child, a kindergartner, whose elementary school is shuttered and closed, that school being really the only safe place in his life. I thought of the 17-year-old who had coronavirus symptoms and went to the hospital and was turned away because he had no insurance. He later died. I thought of those who are alone, who are quarantined away from their loved ones, those like Reverend Horsley describes, who are afraid. I thought of all of us, fearful of the disease and what it might bring. Who do you see? Who do you see surrounding Jesus, crying, Hosanna, help us? This story in Matthew brings us full circle, really, in the gospel. If you remember the birth narrative of Jesus in Matthew, you'll recall that Herod put out an order that all of the male children 2 years and under be murdered. So threatened he was about the birth of Jesus. Mary, Joseph, and Jesus, of course, had become refugees. They sought asylum in Egypt. And here we are at the end of the story, the authorities still wanting so much to take the life of Jesus, watching and wondering, will he come to Jerusalem for the Passover? And so we have to ask, what was so threatening about him? What made them want so badly to take his life? Some have offered that the answer to that question is simply that he offered hope. Hope, you know, is the other side of the coin of resistance and change. He offered those people walking along the road, shouting Hosanna, he offered them hope. This is the locus, I think, the locus of our theological questioning during this season. What is hope? What is our hope? Is God with us? How do we know? Do we know because as we look back through our own life story, we see that God has been accompanying us on the journey? Do we know because of the stories of our ancestors, like the story of Passover, that God was with them in their hunger and when they needed water for their thirst? How do we know? And what are the signs of redemption that are among us? A second reading for Sunday comes from Isaiah 50. In Isaiah 50, we find the third of the four servant songs in the book of Second Isaiah. The suffering servant is called to a preaching, to a speaking, and a listening ministry. He's to speak to the people who have been exiled from Jerusalem. And he is given, in Isaiah 50, he is given a specific task for his ministry. He is to sustain the weary. Sustain the weary. In the servant song, it seems that sustaining the weary is not offering simple or gentle words of consolation, but it's offering instead a reality that can meet the misery and the fear and the despair. It's offering some kind of theological affirmation that opens a new world of possibility, so that the person who needs sustaining is comforted, feels accompanied, feels not alone. The irony in this servant song is that the very words spoken to sustain the weary are the same words that sustain the servant preacher. Because the servant preacher in Isaiah is weary and exhausted too. Third reading, Psalm 31, is an individual lament. It's more graphic than most of the laments in the Psalter. But it's a good reminder to us that worship rightfully includes lament and the gut-wrenching realities of the world that we're encountering. Listen to these words from Psalm 31. Be gracious to me, O Lord, for I am in distress. My eye wastes away from grief, my soul and body also. My life is spent in sorrow, and my years with sighing. My strength fails because of my misery, my bones waste away. But I trust in you. You are my God. My times are in your hand. Save me. I think this psalm is so helpful to us because if you read it in its entirety, you find that it depicts the realities of the life that many of us are experiencing now. This wave of despair and weariness and misery washes over the psalmist. And then as that recedes, a wave of assurance and trust and hope replaces it, but soon the misery returns, and in the home and the hope and the trust come once again to assure this one who is suffering that he is not alone. These texts are like a prism, and how they reflect their light in your community, whatever it is, a congregation or a hospital or a nursing home. It will come in specific and particular ways. I am thinking that perhaps Lent will be prolonged this year, and that when resurrection comes to us as a community, it may not be in one sharp, light announcement of life, but perhaps it will come slowly over time, gently. Silently. I offer to you a hymn that we found we cannot play today because it doesn't play well over Zoom. But the hymn is "It Is Well With My Soul." And I invite you to read the history of that hymn because the words, "It is well with my soul," grow out of the life of a person in the 1800s who knows unspeakable tragedy, unspeakable tragedy. But the hymn is a good reminder that we need not to diminish or minimize the despair that we're feeling. The hymn writer does not. He speaks them, and he also speaks of his unshakable faith. I commend it to all of you in these times when ministry is stressful and demanding. So demanding. You can find this particular version of "It Is Well With Your Soul" on Google. You Google the name of the hymn, and then the choir that sings it is 10-4. I think it's the 10-4 chorus. The 31 people who are singing this hymn are singing in their isolated, sheltering in places. There's 30 or 31 of them singing to their cell phones, and then they are brought together by the person who wrote this version of the hymn. So, you know, for me, when I first heard it, it was not only a reminder of how lament and affirmation of hope are so important, but it's a reminder that in our distance from one another, in our isolation from each other, we can be and sing and speak.
Thank you, everybody. It is indeed well with our soul to have heard from the three of you. We're almost at time. We only have 2 more minutes. And the inspiration that you provided us, the key here is that people have simply listened. And you have offered us so much hope that maybe we don't have words for it right now. So all I can say is thank you so very much to each one of you, Professor Lebacqz, Reverend Horsley, and Professor Turner. Thank you so very much. We are almost at our
presenters for today and the opportunity to see you all back in our community. In the midst of the grief and disorientation of this moment, one of the gifts continues to be the opportunity to connect with one another in new ways. And so we are grateful for that opportunity with you today. So thank you for providing us this chance to be with you. There are a number of other resources we are seeking to make available to you. We apologize that today's time for questions and engagement in the panel is short, it has been cut short, but I want to share one additional resource with you. First, an invitation for next week's webinar will be at 2 o'clock. We welcome your reflections and ideas about themes we should engage. We are planning for next week to reflect on precisely where we have ended this. How do we speak hope into this? What does that look like, especially as we are in the middle of Holy Week? Beyond these resources as well, there are some others on our website, and also I want to share with you an invitation to participate in our Professors of Practice session in April. This is a course some of you may be aware of. It's a public course that has been taught by a number of individuals we have engaged for the year who are leading thinkers and actors and practitioners in various areas, in business and technology and in art. The last portion of this course will begin on April 15th, and it will focus specifically on the role of art in creating an imagination about what the future of our communities may look like. We prepared this course already last year as we were thinking about the realities of how do we have a say in our future? How do we shape a democratic future for ourselves? But the significance and timeliness of that conversation has become even more marked by this moment. We've made a choice to make this available for free to anyone who would like to participate. You can find details of the program on our website at psr.edu/pop, or when you just come to our website, you'll see links to it as well. We invite you to register for this public course. It will take place every Wednesday night at 6 p.m. On April 15, 22nd, 29, and 6. And it will feature our Professor of Practice, Jeff Chang, who is the Vice President for Narrative at Race Forward, as well as our faculty, our Professor Johanna Juncker, who teaches in the areas of theology, art, and spirituality here at PSR. The two of them will be hosting a conversation with artists of color from the East Bay to try to think about how do we give a powerful imaginative possibilities for what the future of our society looks like. Our world, whether it is in that hospital bed that Reverend Winston brought us to, whether it is in the large framework of the realities of making difficult choices in the midst of a pandemic, or whether it is in the hopeful engagement with our historical and ancient texts that shape our life and our imagination. Imagination is critically important and is part of what we bring to offer the world. And the work of artists as that of prophetic voices in our society. It is important that we imagine a new future, a new possibility, to be able to do as Jesus did for his disciples and as other leaders in the church and throughout religious communities have done, to be able to give us space to imagine, because if we cannot imagine a solution, a future, a possibility, as the scriptures say, without a vision, the people perish. So we invite you to be part of that work and at that creative space. Thank you for your participation today. We are deeply grateful to Karen, to Mary, and to Winfred for your participation with us today and for the insight that you have shared with us. And we look forward to continued discussions together next Tuesday at 2 o'clock and in other ways with you. Thank you very much, and may you have a blessed day.